Welcome back to Close Up. Inflation has hit everyone in the pocketbook, but for anybody out there who is somehow unaware of what has happened to the cost of childcare, take it from me. It's gone from expensive to, and this is a scientific term, completely nuts. There's a new study examining the impact of those costs in the Granite State, and this morning we get a first look at those findings. We want to welcome in Nicole Heller, a senior policy analyst with the New Hampshire Fiscal Policy Institute. Dr. Heller, thank you for joining us.
Thank you so much for having me.
So here's the problem, and you know it well. Too many kids, not enough available childcare slots. The numbers in terms of cost in your study are just astronomical in terms of the drag on the economy. You estimate the total economic loss to business income and tax revenue between $159 and $248 million. That's huge.
It is. So this is impacting families, businesses, and state and local tax revenues because there just aren't enough slots. So for families, we're seeing $178 million collectively every year, impacting families. Business losses are looking like almost $56 million collectively. And then at the state level, because folks pay fuel taxes, meals and rentals taxes, business have their business taxes, we see state and local tax revenue losses as high as $14 million based on the predictions in our report.
Yeah, you report, for two kids under the age of 5, $32,000 a year. That's like college tuition at a top university not too long ago. Why is it so expensive?
It's a really challenging business model for child care providers. So they can only charge tuition at what families in the area can afford, and as you just mentioned, it's already quite high. They're also faced with paying their educators, and unfortunately there's not a lot left over when all the overhead is paid. So the child care workforce, the median hourly wage for those workers was $15.62 an hour. And the providers themselves, the businesses, aren't getting rich in the process either. The reports that we're able to find at NHFPI suggests less than 1% profit for these folks. So really, it's just expensive to take care of little ones. As you mentioned, taking care of children is hard work. And so trying to make sure that they have high quality early care and education and a safe and loving and caring environment to be in is expensive. So to meet those costs, childcare business owners are really in a difficult position to try to balance their budgets. So without any sort of external funding coming in, they're doing their best to run their business in a way that makes childcare available to families, but also keeps their workforce there. And that's one of the reasons there is a shortage, is it's just hard to recruit and retain that workforce.
Another eye-catching stat you've got in here. The trend line seems bizarre to me, but maybe makes more sense given what you're describing. Capacity for childcare in New Hampshire went down 13% between 2017 and 2024, even in the face of that red-hot demand. These external forces, is that, essentially the businesses feel like they can't thrive even though there's so much request for service? It
is, yes. So they do their best to make do with what they have. And so one of the things that helps families afford childcare and can also benefit the childcare providers by making sure that they have families come there is the New Hampshire Child Care Scholarship. So in the past biennium budget, the legislature passed an expansion of this so that families who earn up to the 85th percentile of state median income are now eligible for child care assistance to help lessen some of that financial burden, so they're able to send their children to a child care provider and then go into the labor force. And then that helps stimulate our economy. Our business owners have employees. They're paying, the business taxes are going out. Families are having more income to spend in their local economies. And so it's better for everyone that for folks who want to go into the labor force, they're able to access that child care.
And as we get into the solutions aspect of this, what are some of the ways to bolster that workforce to ensure that there is adequate pay and that people do get retained in jobs like this?
Sure, there are a couple different solutions or aspects that policymakers who are interested in addressing the recruitment and retention aspect can pursue. One might be what our neighbors up in Maine are doing, which is their legislature put $30 million toward a tiered stipend system for their child care educators. And what this looks like is, depending on an educator's experience and their level of education, they can earn an extra $240 to $540 every month, in addition to what their child care employer is paying them, as a way to keep them in the labor force for child care work. Another approach is one that New Hampshire is trying out right now. Our legislature's last session approved an expansion of the Child Care Assistance Program, the New Hampshire Child Care Scholarship, so that child care, folks that work in a child care setting can access those child care assistance funds if they make up to 100% of the state median income. So it extends this subsidy to the folks who are teaching the little ones in child care settings so that they can afford to have their own children in child care.
And one of the interesting things you identified in the study as well that might be possible is some zoning changes potentially. You know, if someone did want to open a safe and affordable small daycare option in a home, that's not necessarily as easy as one might think.
So there was legislation that's been passed that makes it a right. However, some municipalities may use particular permits, so those unique
like a special use permit.
Yes,
or
thank
like that,
you.
yeah.
A special use permit that would then require some extra steps and may present a barrier for some folks in particular municipalities if they're faced with that.
This is the vicious circle of all of this too, is that, in order to afford childcare, both parents need to work, but it's so expensive that it probably takes sometimes one parent out of the workforce. How much is the economy missing from the people who are not able to work because they're stuck essentially on the childcare function?
Sure. So our report didn't include the, on average, 17,000 people each month who were out of the labor force in 2024 because they were caring for a child not in school or in a child care setting. So that's a little bit harder to narrow down of what folks' careers they might pursue. We also aren't able to delineate at that level for folks who aren't able to access child care and aren't in the labor force from folks who prefer to be home with their children and wouldn't go into the labor force even if there was available child care. So hashing out those numbers get a little bit trickier.
And some of the most important work there is anyway with taking care of little ones. 17,000 though, that number speaks for itself. As we wrap up here, I do want to ask, this is interesting. This is one of the few issues that seems to have some bipartisan consensus that something needs to be done. Are you optimistic that we can turn this around, I guess, even in the next few years?
It's hard to say. So the governor's budget came out as of taping yesterday. And so my team at NHFPI, we're still going line by line. But what I can say generally is that studies have shown return on investment for early childhood programs and assistance programs that affect early childhood and families tend to have the best returns on investment. Studies over the years have ranged from $4 to over $12 for every $1 invested in early childhood. And the reason that these long-term investments tend to be higher than some of the other investments that states and federal governments can make is because teaching children early on how to be a good friend and how to control their emotions and stop their impulses can have long-term impacts on things like resilience to finish high school, pursue post-secondary careers, or go to college, and can also lower rates of folks in the criminal justice system and who have substance use disorders. So those things that cost more in the long term, we can invest early on, and it may help to avoid some of those things later on in their lives.
All right, Dr. Nicole Heller, thanks so much for your time and expertise on this issue. We appreciate it.
Well, thank you so much for having me.
Okay, and we'll be right back with former actor Andrew Shue to talk about his New Hampshire Together initiative. Stay with us.